I'm Linda Gort.
I'm Chris Glover.
My name is Brianna.
I'm Dr. Mitchell Crawford.
Hi, my name is David Cortez.
It's no secret that many people harbor fears about those struggling with substance use. And these fears can stem from a range of concerns. Whether it's worries about safety, misconceptions about addiction being purely a matter of willpower, or the fear of social judgment, these anxieties can create barriers to understanding and compassion. Today, we're going to unpack these fears, hear firsthand from people who face these challenges, and explore how judgment and stereotypes make things even tougher. It's an opportunity for us all to learn and rethink our views. We're going to get into how stigma affects lives and what we can do to make a difference.
Initially, when I went to seek help, it was terrifying.
Really, I felt like it wasn't going to work. I truthfully didn't think that I would get help. I didn't think that I would get better.
There were a lot of things that I was afraid of. I knew what was coming. I knew that I would have to go somewhere or multiple places. I knew that I would have to stabilize, and it was a really difficult decision. Sometimes those decisions were made by me on my own, and sometimes they weren't.
I got sober at 23 years old. I was so fixated on being younger than most of the people that I saw in treatment facilities local to where I am in the Southeast. I always felt like I was decades younger than the people around me, and therefore that meant that if they weren't sober yet, it was it for me, and it wasn't possible.
Understanding why people use substances involves exploring a range of factors: biological, psychological, and social. This multifaceted understanding helps us grasp why individuals may turn to drugs and how substance use can take hold. The substance use epidemic is marked predominantly by the widespread use of prescribed pain medication. When it was introduced in 1996, opioid prescriptions were marketed as a breakthrough medication with minimal risk of addiction. Pharmaceutical companies assured the medical community that opioid painkillers were safe and non-addictive. But by the early 2000s, the consequences became evident. People who became addicted to prescription opioids often turned to illicit drugs, like heroin, when prescriptions were no longer available or affordable.
We believed for a long time that mental illness and substance abuse disorder were just like, this is a mental health issue. Just get yourself together, get therapy, pull yourself up by your bootstrings. Even some of the chronic diseases, let's pick diabetes, that we say, oh, well, you're just eating junk and you're not exercising. Well, lots of people eat junk and don't exercise, but they don't get diabetes. So what is it about the biochemistry of your body that's susceptible in a different way?
Now, we know what's different about this is addiction is a brain disease, right? So we can see differences when we do neuroimaging. When we look at CAT scans and MRIs of people's brains, we see differences in the structure and the way that the structures talk to each other in the brain. One of the best ways I like to think about this is the stop and the go pedal. And so usually there's a balance within your brain of, I want more, but you can't have more. What's going to be socially acceptable? What's going to not get you in trouble? What we see in substance use disorders is a disproportionate kind of movement towards the go, 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 and less of the stop, stop, stop. And that's really what's contributing from the pathways neurobiologically and the neurotransmitters or the messages that are sent between the parts of the brain.
Understanding these brain mechanisms helps explain why substance use is not just a matter of willpower. When people don't understand how substance use alters the brain, it can result in the mistaken belief that those with addiction have full control over their behavior and substance use.
Some misconceptions that I had about substance use were that it was my fault, I guess. Didn't understand the disease process.
For the longest time, I believed I'm not like them, and them referring to the people that I would see panhandling in the streets, people that I would see really just dirty and things like that. That just wasn't my story until it was.
I felt like all these people were telling me that it was a choice and that I had the choice to choose recovery, which to some degree is true, don't get me wrong, but if I couldn't do that, that meant that like my brain was broken, I guess. That's just the way it felt to me. I went into my last treatment facility thinking that it was going to be a waste of money. I was just going to relapse again. I had a soon-to-be 4-year-old at home, and I just felt so sorry for her. So I was so ashamed of being such a young mother and putting her through some of the stuff that I went through as a child of being raised by parents who were also addicts.
There was very little education on what rehabs were and things of that nature, and so it wasn't even offered to me for the longest time until one day I was exhausted and I said, I've had enough.
The lack of understanding around substance use disorder contributes to stigma in various areas of life: employment, healthcare, and social interactions. People with substance use disorders and their loved ones often face prejudice and exclusion, which exacerbates their struggles and their ability to seek out help without feeling judgment. Media coverage often reinforces the stereotypes of people with substance use disorder as irresponsible or weak. These messages influenced both public perception and the experiences of those affected, making it hard to ask for help even when there was recognition that it was needed.
I think that staying in active recovery and not relapsing or going back into active addiction, I wouldn't be able to do it without a support system. It looks different for everyone, but I don't think anyone can do this alone. I think that idea of needing to do everything alone is part of what keeps so many of us in active addiction.
Learning about the science behind this illness is a great way to sort of understand your loved one and their behavior. And it can also be incredibly helpful to separate that human being, that person that you love, to separate them and their humanity from this illness that we absolutely don't like at all, but we love this human being, right? And so when we're able to separate those two things, that can be incredibly helpful for loved ones. That helps to sort of break away from some of these outdated mindsets where we're viewing somebody as bad rather than someone who is ill.
If you have a recognized problem and you want to get help, how easy is it for you to get that help? And we know that unfortunately folks who have addiction, that it's not easy. In some places it's very, very difficult. And I believe that that is largely attributed to stigma because of how we've historically viewed addiction and substance use disorder specifically. We've historically marginalized people. We've historically invalidated people. We've criminalized people. We've said that they had moral failings and if they just wanted to stop, they could. So why would we devote all the resources that we need medically if that were all true, right? So now we're playing catch up because we understand medically that these are chronic medical diseases, that this is a brain disorder, that this is something that needs medical treatment. And then when you provide treatment, it works. And so we're trying to build all that up now, change culture, and that all goes back to stigma and how we've historically viewed addiction.
I mean, when we better understand, that this is a lifelong chronic thing that we need to learn how to manage, we can just, at that simple fact, create better interventions and better treatments that are more effective. And we can acknowledge that everybody is going to experience this illness a little bit differently, like any other chronic illness, right? And so while one intervention like medication might be very effective for one person, it might not be as effective for somebody else. And so when we understand this illness is going to progress and change over time, and the more that folks understand that, whether they serve in a clinical capacity or a loved one capacity, folks succeed when kind of all those right ingredients are there.
When it comes to the disease of addiction, it goes far beyond that. It's a disease of the mind that we have, and it is something that is going to be with me for the rest of my life. It lies in my thinking, it lies in my negative belief systems, it lies and stays dormant. It goes way beyond the substance. And the sooner that I was able to grasp that, the easier recovery got for me.
We don't shame someone for having a heart attack, cancer, or any number of other health issues. Effective management often involves a combination of medical intervention, lifestyle changes, and ongoing support, highlighting the need for comprehensive care and understanding. Understanding addiction as a chronic disorder helps us grasp the complexity of the substance use epidemic. This epidemic did not arise overnight, but evolved from a combination of factors spanning decades.
One of the biggest challenges that I had was the general admission. Like, I didn't want to admit it. And looking back on it now, I wish I had admitted it sooner. I wish that I had gotten recovery sooner, but I am a firm believer that everything happens for a reason, and everything has its due process.
The language we use and the way we talk to people and greet people and connect with people when they have a substance use disorder is absolutely critical. Now, it's one thing to offer treatment, it's another thing to be inviting and connect with people where they're at and show that you have a better understanding of their experience. It's another thing to sit around a dinner table and talk with negative language and judgmental language about people who are suffering in your community, and maybe not even knowing or understanding that there's people around that table who themselves are suffering, but they don't feel comfortable to ask for help or talk about what they're experiencing because you're already setting up a dynamic that is really stigmatizing. So we should always be talking with language that is affirming of the person's experience, helping them be comfortable. And the more that we do that, the more people feel comfortable to approach us and ask for help.
Resilience is your ability to bounce back from anything. It is imperative that someone in recovery taps into that resilience, because life is life, and the sooner that you tap into that, the easier your process gets.
As far as my empathy towards others, I definitely have had an increase. I am a psychiatric nurse. I work with people, like me every day. I feel like it's allowed me to build a better self-rapport with my patients, and it's allowed me to kind of see past that, and I think that's really important.
Self-awareness is one of the most important things in recovery as well. When you know what your triggers are and you're aware of them, then you can begin building the tools that you need in order to get past all of it, any of it. You have to be self-aware in order to succeed at this thing. Self-compassion is a tool that you need to have, because not everyone is going to give you grace on your time. I feel that it's important to learn how to love yourself and to hold space for yourself, and to understand that you're going to make mistakes, and it's a guarantee.
Rising addiction rates, overdose deaths, and a surge in illicit drug use led to public outcry and calls for action against both pharmaceutical companies and inadequate regulations.
And we know now, right? Like, this is a biological illness. It's a medical condition. And so there's a lot of possibilities for policy to shift how we encounter and support and intervene with people who may be engaging in criminal behaviors because they're trying to survive because of this medical condition that they have, rather than just viewing them as criminals and not human beings.
People probably don't realize or understand that a lot of what I do day to day as an addiction medicine provider or an addiction psychiatrist is dictated by what the law says I can do. So whether or not I can use methadone, which is a proven life-saving medication, will Medicare pay for substance use disorder treatment in a residential setting for someone who is one of their beneficiaries? And so much of what we do, so much of the funding, what we're able to do within addiction medicine is political.
I think the biggest way in terms of policy and community issues always seems to start with, what's the financial benefit? Well, the financial benefit is we're going to keep people working, we're going to keep people engaged in community, they're not going to be in jail. So treatment is a really valuable resource for us.
I also think that we can do more on the prevention front. Like, we need to move way further upstream and address some of those risk factors that make people vulnerable to developing a substance use disorder in the first place.
So how do we eliminate stigma? First, we must all challenge the labels and words we use to describe those living with substance use disorder. By challenging how we talk about and perceive substance use, we can foster a more compassionate and supportive environment.
I feel so honored to have gone through some of the things that I went through, even though it did not feel like that at the time. I feel like I get to see the world in a different way, and really, I've been through those hardships, and I'm so grateful that I don't have to suffer anymore.
I didn't want to trust anybody. I had been so beaten down, and one of the things that I had to realize was there were really good people in the world, and as long as I could find those good people in the world, everything was going to be okay.
You need hope to start this process. You need to have that belief that tomorrow can be better than today and that you have a role to play in making that happen. Recovery happens in relationships. The illness keeps you isolated and alone, and recovery brings you connection. And so in order to feel like you can connect, you need to have that belief that that's possible and that you can make that happen and that you're worthy of that.
I am resilient.
I am a sister.
I'm also a mom and a grandma.
I am a daughter.
And as of January of this year, I'm a stroke survivor.
I am a wife.
I'm also a father, a son, a husband, a friend, a colleague, and a weekend warrior athlete.
I am a mother and I am in recovery.